Good afternoon, ladies and gentlemen. It is indeed another day, a new day, a bright Sunday, the day that the Lord has made, that we should all be glad and rejoice in it. You don't like this day, which other day would you prefer? It is a festive season at the end of the year, the time that all families are getting together, preparing something together, putting heads and hands together to end the year peacefully and successfully. This afternoon, we are here once again, bringing to your doorsteps health issues from Richmond Media. Today's topic is prevent- preventative measures of glaucoma. You might be suffering from glaucoma or a family member. It could be a friend or someone that maybe you might be passing by that might need your help. What advice would you give to such a person? This afternoon, I have someone who is really equipped with knowledge, with ophthalmic background. Indeed, he is a specialist nurse in ophthalmology. This afternoon, I have at the studio no other person than my own brother, Mr. Adesro. Mr. Adair, you're welcome once again to Richmond Media as we wish all families Merry Christmas. Some people might not be celebrating their Christmas because some of us think that Christ wasn't born on that day. But this is the day that the world has introduced that we should celebrate the birth of Christ. Therefore, on behalf of Richmond Media, we wish everyone a Merry Christmas. And Mr. Soro, we wish you a Merry Christmas on this platform.
Thank you.
How are you
We also wish
today?
you the same. By
Thank
the
you
grace
so
of God, we have managed it.
Thank you. When we talk about glaucoma, can you give us the overview of glaucoma, please?
Okay. I thank my listeners who are listening to this episode on this Sunday afternoon. And I hope and pray that by the end of the series, they'll be able to learn something from it, of which it will be of benefit to them. When you talk about glaucoma, I am so happy to be educating people on this because it's one of the conditions of which people are dying off of it, but they don't know that it is the cause or this is what is bringing about the cause. So this afternoon, I'm here to highlight people on what glaucoma is. So when you say glaucoma, that there is another name we used to call it. Usually, we used to say the silent thief of sight. Why is it called the silent thief of sight? Because it steals your sight, or you become blind without you knowing that it is the cause from it. By the time you get to realize this is the cause, it has gotten to the stage of which it's difficult to reverse it back. So we used to call it the silent thief of sight. And when you say glaucoma, there are a group of eye conditions that come together to cause damage to the eye. And when you look at the eye, you have some part that we call it the optic nerve. So this is the healthy part of the eye which helps for good vision. Particularly, when you look at, if you want to look or see something at a distance, what happens is we have the cornea. People used to say it's the black part, but it's not black. It's a white transparent. So the cornea will reflect the light into it, of which it passes through the cornea and it moves on onto the lens, to the vitreous, and to the optic disc or the fundus, where you can locate the optic disc. So where the optic disc is, the optic discs are nerves and blood supply. So the optic nerves will receive the images or the response that is coming onto the eye, and then it will focus it or it will gather it and move through the optic disc into the brain, the part responsible for vision. So this is where you are able to see. So before you can see a tree or you see somebody approaching you, the person or the image must pass through all these stages onto the optic nerve for it to be transported to the brain, for it to be interpreted as vision before you can see. But in glaucoma, what happens is this healthy part, the optic disc, which is supposed to help you see at a distance, what happens is it gets damaged. So the moment it starts damaging, then the vision will start deteriorating or will start decreasing. So gradually, the vision will be reducing. So it will come to a stage where the optic nerve, which will help you to see at a distance, is no more able to focus because of its damage. So in general, I would say glaucoma are a group of conditions or a group of things that come together to cause the damage of the optic nerve, reducing vision.
Thank you so much, brother, for giving us the overview of glaucoma. So, how can someone who doesn't know anything about glaucoma or who has got no knowledge or any background of ophthalmology or ophthalmic diseases and condition, know that the symptoms that a person is experiencing is attributed to glaucoma?
Okay. When you look at glaucoma, as I was saying, this optic nerve which begin to damage, what happens is the moment it begin or start damaging, then the effectiveness or the work of the optic nerve is no more functioning. So what happens is pressure begin to build up in the eye. So in the normal eye, we have the pressures in the eye, just like checking the normal BP of a client or somebody. We also have one for the eye. For the eye, is within 10 to 21. So what happens is since now there is the functions of the eye is not able to function well, this pressure begin to build up. So it will build up to the stage that it will begin to cause some symptoms on the eye, or which the person will now begin to see all these symptoms. So when you look at the signs and symptoms that normally the person might present, mostly the most common one is patient or the client is not able to see at a distance. Please, let's put in mind, if you have difficulty in seeing at a distance, don't attribute it into glaucoma because there are some other conditions. For example, we have the refractive error. It's one of the another condition which causes decreased vision. But that one we correct it with spectacle. We have some other disease that causes like the optic neuritis and other stuff, which also causes damage to the eye, which reduces vision. So when I'm talking about it, unless you have gone to the healthcare provider for him to diagnose that yes, it the cause is from glaucoma. So the common symptoms is reduced vision, as I was saying. Another one, patient may complain redness of the eye. Some too may also complain of headache. Some too may also complain of tearing. So all these symptoms shows that the person is getting glaucoma. And the glaucoma, this symptom, it could be of acute stage or chronic. So for the chronic stage, there wouldn't be any symptom. So gradually, the patient will be losing the sight. And the common one is when you sit straight and look straight forward, and then you stretch your arm, both arms, left and right, straight, not forward, but laterally. If you are able to see what you're doing at the lateral part, then it means you don't have problem. So just like stretching your arm just like this. So if you are not able to see what you are seeing, then it means the damage has started. So another one or another way of seeing it, when you look at your eyes just like this, it focuses object straight forward. But when something is at the lateral part and you're not able to see it, don't take it to be normal because mostly you always focus on seeing straight forward, but you normally don't concern that if you're able to see lateral part. So these are some of the common symptoms that may occur in the chronic state. But in the acute state, you can get the headache, the eye pain, and then the blurred vision that I was talking about. Other symptoms could be nausea and vomiting, halluce around light. Halluce around light is you see some black spots on your vision when you're looking at a distance. You can also get redness of the eye. All these things are symptoms that will indicate that you are at risk or you have gotten glaucoma. But please, some of these symptoms I was talking about, unless it's being confirmed by the healthcare provider, in addition with other diagnosis, factors to be added. Thank you.
Thank you so much. Now that we know the symptoms of glaucoma, then it will be possible for us to know exactly what causes these symptoms. Thank you.
Okay, when you look at the cause is unknown. So as I was saying at the definition, that is a group of conditions. So it's a group of things or a group of things that come together to cause that. So the actual cause, as of now, no research has proven that this is the actual cause. But there is associated things that you use to associate it with. One is the increased pressure in the eye, that is the IOP. When the pressures in the eye increase, the person will be at risk. So these are some of the risk factors that if somebody is having any of these risk factors, then you should be or you should be going to the healthcare provider frequently for checkup to see if you are getting some or not. One is the high intraocular pressure I was talking about. That's the pressure in the eye. The normal one is within 10 to 21. So if yours is above 21, maybe 25, 28, 30, 35, then you need to be monitored. It could be that you are getting ocular pressure. There is a difference between ocular pressure and glaucoma, but they are families. I would say brothers and sisters. So if you are having ocular pressure, that is increased pressure in the eye, then you are higher risk of getting glaucoma because the pressures in the eye will cause the damage of the nerve vessels or the nerves. And when the nerve vessels become damaged, then glaucoma can also occur. Another one is as a result of aging. As you are aging, you are at high risk of also getting it. And we, the Africans, we are also at risk. Research has proven that most of the African countries or the Asians are at high risk of getting it. Also, there is a family history. If there is a family history in your family, you are also at risk. It's just like hypertension. If somebody in your family is having hypertension, you are at high risk of getting the same way applies to glaucoma. It runs through family, it runs through blood. So if any of your family member is having glaucoma, it means you might be at risk. It could be your uncle, your niece, your nephew, your grandmom, your granddad, your sister, your brother. It could be any of your immediate and then extended family. Any of them, you could be at risk. And also, some people has been addicted to buying medication in the pharmacy. One is having headache, you go to the pharmacy and buy drug. One is getting anything, you just go to the nearby pharmacy and buy drug. Some of these drugs contain some chemical or some ingredients we call it the steroid. This steroid, when it gets into the eye, it causes or it increases pressures in the eye. And when pressures in the eye increases, then you become at risk of getting glaucoma. So we always advise that before you go to pharmacy to buy any medication for use, please consult your healthcare provider for advice before you go and buy some of this medication. And some too, as I was saying, in their family, they are having diabetes. If you're having diabetes, or if you yourself you have diabetes, you are at risk of getting glaucoma. Because when the diabetes goes higher, the sugar level runs higher. And it also, the sugar level, it runs through the body system. So as it gets to the brain, it becomes at risk of getting glaucoma because it will cause new vascularization. When I say new vascularization, what I mean is new vessels are being developed in the which means the new vessel that is supposed to last for the number of days before it is being matured, it's not that thing reach that number of days, but it's mature faster or earlier than it's supposed to be. So this new vessel, when it's mature, it doesn't reach its maturity before it starts working. It can burst or it can break, and then it starts oozing up blood in the eye, which will increase the pressures for you to get a glaucoma. Something can be from high blood pressure. If you're also having high blood pressure, the same similarities, it can also cause it. Some to also have some heart conditions, which can also predispose you to getting glaucoma. Another one is near or far sightedness. That one, please, if you have near-sightedness and you're using spectacle, or if you are not able to see far and you're using spectacle, don't say that because you're using spectacle for that matter, it means you're getting glaucoma. No, you are at risk. So if you are somebody who has been using spectacle, you have been prescribed spectacle for it to be used, it is very advisable to be taken up on your healthcare provider frequently so that when there's anything, be able to identify it early and then treat it early to prevent any other complication that might set in. So these are some of the the causes that somebody may present to you. If it's
Thank you so much, brother, for giving us the causes of glaucoma. We have our brother George Osibequin with us. Says, "Merry Christmas, family. God bless you all for such a wonderful program throughout the year." Thank you so much, brother George, for your time, your love, and everything that you are giving to Richmond Media. Indeed, you are supporting Richmond Media almost each and every week. You are with us. May God enhance your territory as you continue to work with us. Whoever is watching us this afternoon, please, you can just pop hi, hello, and we'll be able to acknowledge you, especially within this festive season that we have to wish everyone a Merry Christmas. It's not easy. The Lord has been faithful to us throughout the year, from the beginning of the year till the end. Though it's not ended, but it's almost ending. So we give praise and honor unto the Lord for his marvelous work as we continue to promote health and then to create awareness on glaucoma this afternoon. Brother George, you made mention of the pressure between 10 and then 9. I know some
21.
articles, I'm sorry, between 10 and 21. Some articles also point out between 9 and then up to 24. So in this case, if we have 24, what do we do? Do we have to panic? Or what can we do at all about that one? I know you made mention of that when we get to 25, then it has to be monitored. But when you are around 24, you still keep your heart at ease, or what can you do about that? Thank you.
Okay, thank you. So, as I was saying, it is a research that has been done and it has been proven by WHO, that is World Health Organization, that it falls within this range of 10 to 21. But some other research has also proven that it extends up to 22 and 24, as we were saying. So if you are within 22, 24, you do not have to panic about all these things because it depends on the time of the day, the season, and the period of which it was being checked. Some, if you check it in the afternoon, because the activities has been high, the pressures might go up slightly higher. So you might think that I'm getting pressure in the eye. But mostly, if you check in the morning, continuous, consistent for some time, then you can say, okay, now the still is within 24. So let's go ahead and do some other investigations. I will, like the OCT, the VFT, and then, or you can do the Fondo scan. All these are also type of investigations that will also help to buttress or support what the IOP was given to you before you can draw diagnosis. So we don't just use one diagnostic test to just confirm that the person is having glaucoma. You need to do other tests in support of this. And then the season or the period of which the person was being checked can also be a factor. So you do not have to panic about it. Even if it is high, 25, 30, no need for you even to panic. You just need to see a healthcare provider and then we bring it down as you are supposed to, or what you are supposed to do it, so that it will come down for you to prevent any further damage. So the issue is some will come at the initial stage for treatment. And then when they go home, then those doctors and then nurses and other people in the house will tell them that, oh no, go and use this medication. That is where herbal medication comes in. They will advise them and then they will start using this kind of herbal medication. Some even go to the extent of using breast milk with the assumption that it's going to reduce it. Some even use sea water, sea salt, in the assumption that it's going to reduce the pressures or it's going to take away the glaucoma. Maybe some people even do kind of tell them to see some people for other, I don't know how they even do it, for them to bring the take away the glaucoma. Glaucoma is irreversible. That is one thing you have to put in mind. It's irreversible. What or to the extent that the damage has gotten to, we cannot reverse it again. So assuming if you are able to see 6 feet meters from where you are sitting or you are standing, and the damage occurs, and then you are now able to see 4 meters feet away, it means the 6 meter feet we are using to see, now you can't see it again. It's only the 4 meters that you can see. So God calls you to glory, or you go to your grave. So what you do is the 4 meter that has gotten to, you will prevent the further damage for it to reduce to 3 or 2. But rather try as much possible that it will remain the 4 meters so that it doesn't cause blindness. Because the moment the meters is reducing, then the damage, it means the damage is increasing, and then the vision is also deteriorating more. So where it has gotten to, you stop it to prevent further damage. So you need not to panic when you see some of these things occurring, but you need to see a healthcare provider. Thank you.
Thank you so much, brother. You made mention of that breast milk. What is the evidence behind that, or even traditionally, has there been anything proving that breast milk can, maybe do something or can even be treated glaucoma with? Is there anything like that?
Thank you. From my period of being in this profession, I have not seen anything that has shown that taking breast milk or using applying breast milk on your eyes will help reduce glaucoma, or using any kinds of traditional medication on your eyes is going to reduce glaucoma. There isn't any proof, but rather there is. So when we started from the beginning, I made mention that when you talk about glaucoma, we don't cure it, but rather we give treatment to reduce the damage of it. So, of which the damage has gotten to, we give the treatment to reduce it. But there isn't any proof or research that has proven that if you use breast milk or if you use this herbal medications on the eye, it's going to reduce it. But rather, it's going to give you another trouble, because the glaucoma will not go, so it will be there. And then this herbal medication you are applying on the eye can even cause some other damage to the cornea or to any of the structures of the eye. So why don't you see a healthcare provider for better treatment than going about spending money, wasting your time on this kind of herbal treatment? Thank you.
Thank you so much. I can see that throughout your submission this afternoon, you've already given us the risk of having glaucoma. Do you have any specific ones that you want to add to the ones that you have already pointed out?
So one with apart from what I've just mentioned, there is another one we can say frequent exercise. It's also very good, because the moment you exercise, it helps to maintain the sugar level, and then it also helps to control the BP level, because the more you exercise and eat the required nutrient that is needed by the body, it will help to reduce the risk at which the BP will go high. If the BP go high, that is where it gets to the extent of um, uh, causing the damage to the eye. But if the BP is low and there's no history of glaucoma in your family, then you are good to go. You have no problem. There is another one, could be of trauma. Trauma can be from accident. Trauma can be from blow on the eye. Trauma can be for anything that hits the eye excessive or extensively or very hard. Those things can cause or can predispose you to get glaucoma. So we encourage that use spectacles. It depends. Maybe you're somebody who does a job that needs for you to protect your eye. Then you have to put on the required spectacles so that it doesn't cause any trauma onto the eye. If you are driving and you're having case, or you yourself, you're in the car, you need to put on your seatbelt. All these things are preventive measures that will prevent this trauma that might occur during the course of accident. So if you are able to do some of these things, then we are able to prevent the occurrence of this condition, or you are able to save yourself from all this risk. And then lastly, I will also say that we need to go for frequent checkup, no matter who you are, whether you've gotten it or you don't have it, whether there's a family history or not. At least 6 months, or if you're not able to go for twice in a year, at least once a year that you have to. Because the moment you go once in a year, we check, we do all the investigations, and we see that there's nothing there. Then we ask you to come back again. So continuous checking every once in a year will help us to know your history line, so that if you know that if something like that is about happening, you know it, and we will be able to help you prevent or help to sustain the severity of it. There is a saying that I used to tell people that early detection, early detection, early prevention, you save sight. So if you see it early, you treat it early, and then you save your sight. But if you stay there and then you don't come, and then it becomes late, late detection, late treatment, late way of preventing your sight. So why don't you come early to prevent all those things from happening? Thank you.
Thank you so much, brother. I am a glaucoma patient. My doctor has given me a number of drops to maintain my sight and to keep the pressure under control. My pressure is within the normal values, which is acceptable under the NICE guidelines or the World Health Organization recommendation. Now, should I continue using these drops, or can I stop? Or can I even skip in between the treatments? If I think I'm all right, I can see and my pressures are under control. Thank you.
Thank you. I like that question. But before I go on to the question, I want to say something like, um, once you have been put on the medication, you started with the medication, just put in mind that it's just like taking the BP medication. You are going to take it for life. No matter whether you like it or not, you have to. You need not to skip one dose. Another example, let's take those with retroviral or the HIV patient. They take their medication every day. The moment they start skipping the medication, what happens? The symptoms begin to reoccur again. So the same way applies to this. You need to take your medication every day. So the every day taking the medication, it depends on the value of your glaucoma, the value of the pressures in the eye. Some people you have something we call normal tension glaucoma. Normal tension glaucoma means that the pressures in the eye are within normal. That is can be within 11 to 19 or 10 to 21. It will be within that range. But yes, so there's other damaging caused on the eye. So when you look at the glaucoma, we have so many types. We have types of glaucoma. You have the open angle, the closed angle, and others. So all these types are types of glaucoma. So it depends on the type of glaucoma which is occurring on the eye. So although the pressures are normal, doesn't mean that you are supposed to stop taking your medication. You need to continue taking your medication. I was reading some research book online, and I got to know that some people will be taking their medication all right, but yesterday the damaging will be going on. There's nothing that you can do about it. The person will be taking his medication all right every day, whether he's taking it, he's dropping on the eye in the morning or in the evening, or he's only dropping it in the evening. Depending, some we use them, they apply them one drop in the morning, one drop in the evening. Some we tell them to drop it in the night. So depending what your prescriber tells you. That's all this thing the person is doing, or at the same time the damage is still ongoing. We have some about 10% of those people that normally it happens to them. So such a person can't do anything, but you still encourage him to take the medication, and then you encourage him to take right diet or good nutrient or nutritious food, and you just encourage them. You can't do anything about it. So you need to take your medication every day, whether the pressures are normal or still not normal. If there is a need for us to ask you to stop, when you come and see us, you will tell you that no, now the pressures where it is, let's reduce the quantity. At first you are dropping it morning, afternoon, evening. So now drop it morning, evening. Or at first you're dropping in the morning and evening. Now drop it in the evening alone. Or now you are dropping in the evening alone. So let's make it alternate. You drop it today, the next 2 days time, you drop it again. The next 2 days time. So alternate days, 2 days. Every 2 days you drop one. Every 2 days drop one. So we have some other means of asking you to use the drug. But there's no way that you're going to ask you to stop using the medication, or you yourself you stop using the medication. Thank you.
Thank you so much. What if, is there any help for the elderly ones who are not able to administer or instill the drops just because of their age, or maybe they've got arthritis or something?
Okay. So the advice we give to them is they should drop it on the eye at least. Get somebody, whether it's somebody in the house, relatives in the house, who will help them to, or by dropping it for them every day. So we always advise that you tilt your head backward a little, and then you open the eyes widely, and then you touch the bottle, and then you squeeze it just a little. With a little touch, the drop will come, and then it will drop on the eye. Then after that, you don't squeeze your face, or you don't squeeze your eyes, but rather you close it gently for maybe 5 minutes time, after which the person can go on with his activity. So the person assisting him to do the dropping will help the person to tilt the head back and then drop it gently on the eye, on both eyes. So that is the advice I can give to them. And make sure that the bottle, the tip of the bottle, does not touch the eyelashes or the eyeball, because the tip is sterile. So we don't want to contaminate the bottle. So always you raise it a little bit higher so that it doesn't touch your eyes or the skin of the body. After that, you close it gently. And when you open the tip, make sure that you turn it up. The in supposed to go up so that it doesn't touch the table or whatever you're going to put the head of the tip. So you turn it upward. After that, you just pick it and then close it gently so that it doesn't get contaminated. And another thing is, depending on the type of medication you're using, some of them we are asked to put in the fridge because of the concentration and other stuff in it. So you just have to listen to what your healthcare provider will tell you, and then you just follow by it. Okay.
Sorry. You made mention of one type of glaucoma. Do we have other types at all, please?
Yes, as I was saying that we have the open angle glaucoma. So we also have the closure, the angle closure glaucoma. You can also get traumatic glaucoma, and you also have glaucoma in children that it can also occur. All these are types of glaucoma, but the the result is they are all glaucoma, or at the end is the glaucoma. Just that the mode of which it occurs differs. Some, because when you look at glaucoma, what happens is when you look at the eye, there is a normal hemo fluid that is being produced on the eye. So as it produces, it moves through the eye, passing in front of the eye, and then leaves the body. So some of them, as the fluid has been produced at the ciliary body in the some part of the eye, as it gets into the anterior chamber or some structure, we call it the anterior chamber. When it gets there, instead of them to leave the eye, they are not able to leave. They stay there, and then they build up the pressure. And some too, the channel at which the fluid is passing through has been blocked. So the fluid is not able to go, and then they also stay in the eye. So all these things are types of glaucoma. Some with the children's one, some can be that the child was born with it. So as the mother delivered, the child came with the glaucoma right from birth. So that one we need to manage it, and that one we normally do surgery to correct it because of the early, because you can't be dropping eye drop for a day old baby or maybe 6 months old baby so the person gets to 40, 50, 60 before he dies or whatever. You can't be dropping the medications always. So for the children or for the kids, we mostly do the surgeries and then we correct it. And the surgery, I won't say it's 100%, but it's about higher percentage that the person will be okay and then survive without even applying the medication again. But for the older people who got it maybe during the course of their developmental stages or who got it during as a result of some other thing that popped in, that one day we encourage to take the medication, but rather we don't do the surgeries for them.
Thank you so much. But some of the adults, they do get the surgery. And if they get the surgery, is there any chance that the uh, glaucoma, that is the end of the glaucoma, or did they still experience the symptoms of glaucoma after the surgery?
Okay, I would say it's about 50-50 chance. You do the surgery in adults, and then there's a 50 chance that the person will be okay without applying any medication onto the eye again. And it's a 50 chance that it might reoccur again, that the person needs to start with the medication again due to other symptoms or other things that may occur after the surgery. So some will also say, okay, fine, I'll go for the surgery. If you are lucky, or if you are be at the higher percentage, then you are good to go. If not, you have to start the medications again. And the surgery costs a lot. It's expensive. So going through that expensive surgery, and then at the end of the day, and then you come back to put the medication again. Some will say, okay, then let me start taking my medication, and let me just live my life as it is. So it depends on the individual, what he or she wants.
My doctor is offering me the surgical treatments, which I think it is too early for me to have that type of treatment. Is there any chance that I can wait, or should I just go ahead and do the surgery? The reason why I'm saying this is because the doctor thinks that if I wait any longer and anything happens, that is my own problem, because he did offered me the surgery. In this case, what should I do as a patient?
I would advise you listen to what your doctor is telling you, because he has done the other investigations in addition to what you just said. So we have other investigations, like as I said earlier, the OCT. The OCT will capture the eye, and we will see the back to see the nerves, the how strong it is, and then the damage it has gotten to. Can we do something about it, or should we put the person on just medication? We also do some other things like the fundus scan and stuff. All these things will give an impression to the doctor for him to know that the stage at which your glaucoma has gotten to, if you do the surgery, it will help you more than maybe putting you on medication. So all these things will be taken into consideration before the doctor comes in with the plan that it's better for you to do the surgery. So once the doctor has given you the assurance, you need not to waste your time to say that you want to continue using the medication, because using the medication is troublesome. It's not easy. Every day you have to be dropping it. It's not easy. Looking at maybe your shift, what the kind of work you do. You wake up maybe as early as 4, 5 a.m., go to work, you come home late in the night. When are you going to be dropping all this medication on the eye? So if the doctor says that, I would advise you to go for it. But if not, you need to just keep on with the what you are being given. I think that will help you a lot.
Thank you so much, brother. For brother there, for giving us everything that we need to hear about glaucoma. So we will finish it by giving the um, whose recommendations that will help every individual to be very careful when they hear of glaucoma. There was one question that I wanted to ask before this one that has just clicked on my mind. If fine, I know glaucoma sometimes some people they complain of pain because of the eye pressure, depending on how high it is. My friend is also been complaining of that, and my friend said, "Oh, she is got glaucoma." I've not had any experience of that. At the moment, I'm suffering from pain, severe pain. I cannot even close my eyes. Should I just think that, oh, it should be a glaucoma because my friend was complaining of that, and that's the doctor gave my friend some medication. So why don't I go to my friend to ask her to give me some of her medication to apply it or install it into my eye? What is your advice on this? Thank you.
Thank you. My advice is for you as an individual to go and see your doctor on eye for him to also prescribe it for you. The reason why I'm saying it, I quite remember, if I'm not wrong, about 4 months ago, Apollo became high in Ghana. So everybody, most people come to the eye clinic that have gotten Apollo. I asked you that, how do you know they have gotten Apollo? I say my eyes is red, so I'm getting Apollo. I say, Master, you are wrong. Redness in the eye doesn't mean it's Apollo. You need to come, you do some other tests. At times, you need to take some samples for culture and sensitivity tests in the lab for it to be confirmed that it is. Some come with bacterial conjunctivitis and then they will call it Apollo. Some come with other, maybe acute stage of glaucoma and they will tell you that it's glaucoma, it's Apollo. So you getting the pain in the eye doesn't mean that you have gotten glaucoma or you are getting it or you might get it. It could be that maybe for the past 1 week you have not had enough sleep. So already you have stressed the eye for or the body for the whole week. So the body is tired and the eye is stressful, so it's also tired. So that you can get the pain. Another one too is some people may come with complaint of dryness in the eye, or this dry eye syndrome can also present with pain. So the person will come that I'm getting pain, but actually it is not pain, but rather it's burning sensation. He sees that there's something burning on the eye, but he or she explains it as pain, which is not pain. Another one too, people also come with refractive error. Refractive error, if you're not using your spectacle, you're likely to also get the pain. So all these things are some of the things that comes and then we experience the pain. As I was talking about the signs and symptoms, I made mention that all these symptoms that I'm talking about, the signs and symptoms I'm talking about, if you experience one or two of them, don't attribute it into glaucoma to be that it's glaucoma, unless you come for us to confirm that it is glaucoma. Until then, don't say that it is glaucoma, because some of these symptoms may be one or two of them, and it means something else, which is not even glaucoma. So you need not to complain and draw conclusion. There is during the COVID time, people were forced to put on the mask. This is one of the effects of the mask. The prolonged use of the mask. What happens is when you breathe, because now you cover your nose, when you breathe, the air passes through at the side by side of the nose. And then what happens is it goes straight to the eye. So the moment you breathe, it goes there. The moment you breathe, it goes onto the eye. So in that case, it will cause dryness in the eye. And this kind of dryness, if you're not careful, you say that it is pain, and then it is something else that you start to attribute it onto it. So you need not to just go to your friend and take the medication. Your friend will prescribe the medication based on his complaints and the diagnosis and what it was occurring on the eye. So you might use the drug and you might even worsen or cause another trouble for yourself. So please, it's better you see a healthcare provider. Thank you.
Thank you so much, Brother Soro, for giving us, the in-depth understanding of what we want to hear about glaucoma. And the types of glaucoma, you've taken us through the symptoms and causes of glaucoma risk, and even investigations and treatment of glaucoma. You've given us the advice of what we should do when we are being diagnosed as glaucoma patients. At this moment, we will bring the program to an end. Do you want to summarize it in a way that you want our viewers to understand in a simple terms? Thank you.
Thank you. So in simple terms, what I want to say is glaucoma is one of the causes or the leading cause of blindness in the eye. So this symptom or this condition comes with redness, pain, and then reduced vision. And the mode of spread, there isn't any cause, but rather it could be a family history or maybe using of other medications. In treatment, if it is a child or early stage, you can do the surgery to correct it. But if it's late, we put you on medication. Lastly, you need to eat good diet, like you eat food that contain vegetable, fruit and vegetable, especially the carrot is very good for the eye. Fish and other vegetables and fruits and vegetables are all good for the eye. So it will help to maintain or give a healthy eye and then reduce the at risk at which it can occur, some of this condition can occur. So all the food that contain vitamin A,
Ladies and gentlemen, it is indeed a good day on point. Our brother has taken us through to the causes, symptoms of glaucoma, how it occurs, how can we recognize it, the investigations that needed to be done in order to diagnose you as a glaucoma patient, the risk involved, and the treatment as well. This is really what we can do. And our brother has taken us step by step into it, which we do appreciate it so much. Brother Sro, may God richly bless you as you have been able to take us through this program today. It wasn't an easy topic, glaucoma, but you have been able to give us what we need to hear. Ladies and gentlemen, it is us for us to understand, to spread the news, to advise ourselves, to follow instructions that the doctors have given to us in order to maintain our health status when we have glaucoma. Look after your eyes very well because your eyes are very, very important. I always say that the eyes are very small. It is part of the brain, but very tiny, but it does so many things. When your eyes are not working, that is where you understand what a real life is. Blindness is real. Glaucoma is one of the leading conditions causing blindness. So please look after yourself. If you have any problem with your eyes, do not hesitate to go and see your doctor. Talk to your doctor. Your doctor will be able to advise you. Our brother Sro was wrapping up, so I'll bring him back to complete his statement. Thank you.
thank you. So in the end, what I wanted to say is that so one is the best way of prevention. The preventive measure is the most important thing that I want us to know. So when you see some of these things, the best treatment is early detection. If it is early, then we put you on the medication. Sorry, we do the surgery and then we prevent further damage. But if it is late, you'll be put on the medication for the rest of your life. And then taking the fruit and the vegetables is very good for the eye. It will help to maintain the healthy eye, the vitamin A supplement food. It will help to maintain the eye and prevent further damage to the eye. So when you take all these things and do regular checkup, you are good to go and you're able to take good care of your sight and then you save your sight from getting damaged. Thank you very much.
Thank you so much, brother. May God richly bless you as you celebrate. Everyone celebrate Christmas tomorrow. We wish everyone a Merry Christmas. Enjoy the festive season with our families and friends, wherever you are. Christmas messages is coming right from Richmond Media. If you don't celebrate it, don't be offended. You are part of the world. Therefore, everything that is happening around us has to be celebrated, has to be known by others who are enjoying it. We wish you a Merry Christmas coming to your doorsteps right from Richmond Media. Don't go. Just turn yourself around and please join me for another program called From the Beginning Life Experience. Until the same time again, next week, the same time every Sunday. Until then, my name is Hanna Bimah, and then I will see you again. Have a good Christmas season.
Suffering.